this was my identity.
Nobody talks about how freaking hard it is to be a dentist. What most people talk about is how this affects the patient. What nobody talks about is how this affects us. Dentistry is ready for this. Now is really the time.
Welcome to Wellness and Dentistry, where today we're going to be talking all about team conflict. Is it the conflict itself or the culture in the practice? I'm joined by my really good friend and my co-host, Dr. Kyle Stanley, who's a dentist, tech entrepreneur, speaker, and researcher. And I'm Dr. Martin Mendelson. I'm a disabled dentist, coach, speaker, and author. And my first book, One Move Makes All the Difference, is available for pre-order before its official December release. And together, Kyle and I have helped thousands of dental professionals pursue wellness and dentistry. And if you're unfamiliar with us, check out our respective links, websites, and course offerings on our combined website, wellnessinDentistry.com. So, Kyle, how you doing, man?
I'm doing good.
Yeah.
I've had a busy few weeks. For those of you that don't know, I started a dental tech company called Pearl. Since then, I've been advising a lot of dental tech companies. So I help a lot of them with raising money and going to market and product market fit and that kind of stuff. And just in the last few weeks, I've been focusing on one of my companies called Two Front, and just we were raising some money for a new stage in their journey, and it's really exciting. Got a lot of people on board. A lot of people are really excited about it. So it's a good time to be in dental tech for sure.
Yeah. No,
But
totally.
I'm interested to hear about your week last week because you were at ADOM and you and I haven't talked since you were
Yeah.
there. I mean, you sent me a few texts, but
Yeah.
why don't you explain what ADOM is? Because I didn't
Yeah.
know until maybe 5 years ago, and then
Mhm.
I'd love to hear your experience.
Yeah, ADOM is a great organization. It's the American Association of Dental Office Managers. And I've been familiar with ADOM for years because I'm really good friends with Laura Nelson, who founded Front Office Rocks. And I was not prepared for what an absolutely fantastic meeting it was. I mean, first of all, there were 1,500 people there, and they had a 300-person wait list.
I mean, that's crazy because we can't get dentists to come to CE courses.
And by the way, although it was mostly managers, of course, there were a good number of dentists there. I will tell
Yeah.
you, there were several dentists in my courses, which we'll talk about. Um, the other interesting thing was that it had more exhibitors or corporate partners than any meeting of its like I've ever seen outside of a major meeting like Chicago Midwinter.
Right.
And they had a wait list. And by the way, your buddies at Pearl were there and they were giving away crumble cookies, by the way, which were very
Ah,
popular.
yes, bad influences on everybody.
But it was an amazing experience. It was a humble experience. One of the things that I respect most about ADOM is, their tracks. They're like fellowships and diplomat and all those tracks.
Oh, cool. I didn't know they do that.
Oh
Wow.
yeah, and they do a whole graduation ceremony. It's a really big deal, as it should be, because as they were, let's call it, reminding the audience of what this is, nobody has to do this stuff. No office manager has to do this
That's
stuff.
what I was just thinking as you were saying it. It's like
Yeah.
we can't get dentists who have to
Yep.
renew their license
Yep.
every 2 years to come to in-person events. But these office managers, who a lot of people would say this is just a job,
Yep.
are paying themselves to go. They're doing accreditation. They're
Yeah.
becoming
Yeah.
fellows. I mean, can
Un
you imagine if someone applied to your practice for a job offering and they're like, well, yeah, I go to this event every year. I'm
mhm.
actually a fellow.
Yeah.
I've done
Yeah.
these tracks, like
Yeah.
shows the perseverance.
Yeah. It's like FADOM, DADOM, MADOM. They got all the different accreditations, and it's truly an unbelievable meeting, an unbelievable experience. I could tell you, I lectured to a total of 139 people out of three different lectures, one of which was a pre-conference with Ryan Vett and some of my other colleagues from SCN, the Speaking Consulting Network, which was a great experience too. We were talking about leadership coaching and also taking what you learn in the practice and bring it to the podium, or creating thought leadership, or
Mm.
writing books and those kind of things. So that was a great experience as well. And I gave two separate sessions, same topic, on what's called From Dialogue to Dynamism. So it's my take on mindset leading into listening skills and then difficult or crucial conversations, which was incredibly well received, both in the two from ADOM, but also even last night, I gave the same topic, different title, same topic to Seattle Study Club virtually. And
Mm,
every single one of those events, because I now use a platform called Talkadot. Everybody who gave evaluation, which was 100%, they all said it was 100% valuable. So it's this soft skill stuff and this culture stuff that really is quite important that people are more leaning into more these days
it's
than they used to.
growing. I forgot, I don't know if I told you, but I did a virtual question and answer session with the Academy of Osseointegration, and they
Mm,
have a young, what do they call it? Young clinicians group, I think is what they
yeah.
call it. So it's like if you're under, I don't know, 45 or 40
Mhm.
or something like this. And what was interesting was so many of the questions were about mental health.
Yeah.
Now, of course, maybe that's just because it was me speaking, and that's kind of what I'm known for. They
Could
did
be.
ask about AI, they did ask about tech, they asked about some career growth stuff, having a practice. But so much of it was, how do I balance growing my career and maintaining my mental
Mhm.
health?
Yeah.
And it was really rewarding. I mean, I know you like this too, but when we can catch younger
Yeah.
clinicians, or in this case, even younger office managers, let's just say younger dental
Hmm.
professionals,
Yeah.
can really make a big difference on the community.
100%.
To catch
100%.
them before they have the burnout or before they leave the profession, right? And have them have this sustainable success from the time they're in their 20s even. I mean, I wish I had that.
Yeah. Well, and we hear all the time from people that are in their 40s, 50s and up that they wish they had it back then. So it's almost like a universal experience, unfortunately,
Yeah.
at this point. But
So this topic of today is
yeah.
we're talking about team conflict, which is one of the
Hmm.
biggest
Yeah.
complaints that
Yeah.
Martin and I hear from dentists and
Hmm.
really from team members too. Um, is it the actual conflict or is it the culture? And before you answer,
Hmm.
I want to hear from your perspective to how you would define culture, because
Hmm.
I honestly never heard about quote unquote culture in
Yeah.
the workplace until I was
Hmm.
in the tech world. And in the tech world, it's crazy that culture is one of the leading questions
Oh,
that
yeah.
young engineers, for example,
Hmm.
ask
Hmm.
for.
Yeah.
Like almost even more than what am I getting paid or what is the product? It's like what is the culture of your business?
Yeah.
And it sounds like that's moving more towards the dental world. So let me know your
Yeah.
thoughts on that.
I would define it as the rules of interpersonal engagement within a practice that's driven by psychological safety.
A
And
great definition, actually.
it's a fancy schmancy way of basically saying that we agree to act in a certain way because we feel okay bringing anything and everything to people's attention.
Mhm.
And that's how we define it. And I have another example from last night, but we'll get there in a minute. But that's how I would
Yeah.
define it. So because truthfully, particularly in smaller practices, it's not the situation that's the problem, it's the culture. And you hear this all the time, or let me rephrase, that's not a fair statement. You hear often, well, we have trouble dealing with this because one or two of the people, always makes it difficult afterwards. Well, that's not acceptable behavior, period. And the fact that it's been allowed, not to point fingers, but we're talking just culture overriding acceptabilities here. The fact that it's been tolerated, how about that, is part of the problem, frankly. And so I've never thought of it this way before, but I went to a private high school when I was, well, obviously, when I was younger. I went to a private
When you're
high
in high
school.
school?
Yeah. And bullying and hazing was not allowed. And if you did it, you got bounced. Now, granted, it
Mhm.
was a private institution, so they could do
Right.
that, right? But it was a culture thing. I mean, you could argue there were rules, but no, no, no. There was an overriding culture. It's like, no, we don't accept that here.
Hmm. Well, I'm thinking about this. It's not the conflict, it's the culture that's the problem.
Hmm.
And what I'm thinking of is that has to be the case because every practice has conflict,
Right.
but not every practice has deep-seated
Correct.
resentment, you
Correct.
know? And so it's like what you and I talk about in when we talk about in Light Side Live is you're going to have shitty patients. You're
Yeah.
going to have team members that suck. You're going
Yeah.
to have bad reviews. You're going to have people that show up late. That is a guarantee that it's going to happen.
Yeah.
Now, there's certain things you could do to avoid some of these and have them not happen, but in general, they're still going to happen. So what you and I mostly talk about is how to deal with things once they've happened, having the mindset around it, having the
Hmm.
frameworks, having the communication tips, having a team that supports you. And this seems kind of the same way, which is conflict's going to happen.
Yeah.
But if you take the same conflict in team A that
Hmm.
doesn't have psychological safety and will not bring things up to each other, you have this deep-seated resentment that can go on for years. You take
Hmm.
that same conflict and you put it in this other practice where, like the ones you've come out to and trained them,
Hmm.
and they solve it in a day.
Yeah. Yeah. Well, it's like the practice in New Hampshire I talk about quite often where we established an alliance, which, um, oh, I never thought of it this before. Maybe we'll call it a culture constitution from now on.
Oh, I like that.
Oh, isn't that fun?
That's really good.
Um, and they agreed what kind of practice they want to show up to every day, how they're going to show up when there are challenges, and how they're going to keep each other accountable. And I remember the first Zoom follow-up we had after we established the alliance. They had quite a number of hygienists, but one of whom in particular was super excited to let me know what happened. And apparently, one of the front office personnel changed the schedule for this hygienist, put a patient in or something, and the hygienist started to kind of feel, I like to use the word squirrely about it, and she put her hand up and used their safe word, and that gave the front office personnel the insights like, whoa, what's going on? What's the problem? Well, I was thinking you did it for this and this reason. Front office personnel was like, no, 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 no. Oh my gosh, I'm so sorry you thought of it that way. That's not wasn't my intention at all. And they were able to move forward. And they were so excited to share this with me. And I think this got really hammered home for me last night when I was doing the virtual for the Seattle Study Club in Illinois, because one of the doctors shared that they have a whiteboard in their, I guess, break room. And I forget the word that they use, but basically, when there's something wrong that they need to talk about, they write it on the board.
Hmm.
And then they talk about it in the next meeting. And then somebody else within the club meeting, a member was like, well, can't people read people's writing? Don't they know who said it? And I just thought that was so fascinating because I piped up and I said, that's an example of culture because we have an agreement that we're not gonna let things go. We're gonna talk about it when the time's appropriate, but we're not gonna sweep it under the rug. So again, is it the situation or is it the culture?
Well, as you were giving that example of that practice in New Hampshire, which I think is uh, our mutual friend,
Yeah.
right? Yeah.
Yep.
And a light cider that's taken our courses before. I was thinking of how you described how the front office wasn't offended and he or she came with curiosity.
Yeah.
It was like, oh
Yeah.
my gosh, what's going on? Like, instead of, what's the big deal?
Yeah,
You know,
exactly.
I mean,
Well, and
totally different responses.
yeah.
But I
Yeah.
think after someone's had a little bit of training, especially from you as the expert, they're going to come with curiosity. They're not going to come as, oh my gosh, I can't believe she said that. What I just put it one, it's one
Hmm.
patient. Gosh, come
Hmm.
on, Jenny, it's one patient, you know?
Yeah, yeah. Well, and as part of any one of these culture constitutions, I think that's the new word, or the
It's a
new
great
phrase.
word.
Oh, I
Yeah.
love it. It's
Yeah, I
fantastic.
like it.
Part of it, them always are, and these are never my words or my thoughts. These are facilitated through me for each individual practice. But I can tell you over and over and over again, in the accountability section, there are always words or phrases around lack of judgment, coming with an open mind, being willing to hear the other side, etc. So when you have the alliance in place and you remind people of it on a regular basis, And no, I do not mean read it on a regular basis. I mean remind everybody. Um, what ends up happening is when it's invoked, those concepts become top of mind and it gives people a pause for them to go, okay, what's up? Maybe I'm not looking at this the same way. Because we're not trying to get everybody to think in the same way. We're trying to get everybody to at least process similarly in a lack of judgment place so that we can have mature conversations and move ourselves forward in a safe environment. And, flying off the handle, getting hot under the collar, not being willing to work with people, that's not acceptable. We kind of talked a little bit about that last night too. It's like, look, not everybody's meant to be here. And we've got to be okay with that. As challenging as it is right now to find and retain dental team members, there's still too high of a cost to allow poor behaviors to fester like a cancer within a given practice's culture. It's not worth it.
This was my question with that is, and I think you answered it, but I just want to make sure. Do you think that there are people that just could never see the other side of that, or are not mature enough, or haven't gone through enough, that they're never going to come at something with curiosity? Like, I'm an example of this. So you
Mhm.
asked me before 2018, which was my
Mhm.
burnout year, and you come at me, I'm coming at you twice as hard.
Yeah, yeah, yeah.
Now, I'm not like that anymore. I still have that tendency, which is like a competitive tendency,
Sure.
but I'm much more likely to say, oh my gosh, you may be right. Let me
Yeah,
look at it another way.
yeah.
Where do you think people are on it? Do you think that there are going to be people that just, they're not going to get it? They haven't
I,
gone through enough. They're not mature enough. What's your thought?
I think that people's emotional intelligence is a continuum throughout life.
Yeah,
And what you just described is one of my favorite phrases of all time, which is people do the best they can with the skills they have at the time. You didn't have those skills 2018 and prior,
I
you
didn't.
do today.
Yes.
And we met in 2020
Hmm.
and you're one of my favorite people and you and I have this really great working relationship and friendship where we can say pretty much anything to each other.
Yeah.
And it's taken with knowledge that it's coming from a place of care and concern, not
Yep.
criticism and ridicule. So it ends up being a skill, and at the same time, what I'll say is that, yeah, there are some people that are unwilling to grow. They're
Mhm.
unwilling to change. They're unwilling to consider other alternatives. And that's their journey, if you will. That's their path. And there's only so much we can do with that.
Yeah. Well, I'm thinking of, like you were saying, our friendship, and we are there to support each other, but we also push each other. I know there's been
Yeah.
times where you'll complain to me about something, or I'll complain to you about something. I'm going through this, and the other person will come back and say, have you thought about thinking of it in this
Yeah.
way? Or, have you thought about the other side that it may be like this? And when you have two people that know each other well and know we're coming from a good
Mhm.
place, you can have these conversations where you're like, oh
Yeah.
shit, I think,
Yeah.
I think you're right, actually. Or I could say, no, no, I don't think you're right. And we could continue the conversation, right?
Yeah.
But there's something so nice about knowing that a person is not there judging you, that is really, truly trying to help you, but also being radically honest.
Yeah. Absolutely. Because we we have to create that opportunity for honesty for us to be able to grow and be better. Um, because without it, we end up stagnating, right? So life, either you're growing or dying metabolically, right?
Yeah.
So
I can't remember who it was. It's either Ramsey or Ritter that talks about that. They basically said you're either bread or wine. You're
yeah,
either getting stale or
yeah,
you're, getting better over time, right? And like
Yeah,
wine is
yeah,
the one that gets better over time, and bread is
yeah.
the one that gets stale. Yeah, I'll never forget that.
That's cool.
Yeah, it's a good little visual to think about
Mhm.
too. How do you make this important for team members?
I truly believe that mirroring that behavior yourself is what's really important.
Hmm.
Because if you are not walking the walk that you're talking the talk around,
True.
people pick up on that. And by extension, when you're tolerating inappropriate, poor behavior, that also sends a message to the rest of the team. Now, that doesn't mean that you can handle everything immediately on site, but there's a difference between something untoward happening on a Monday and dealing with it within a day, a week, a month versus allowing something to fester for months or years.
Yeah.
There's a difference, right?
Yeah.
So it's
I'm thinking of my own experience. And what's funny is when I think back to 2017, 2018, I was a poor leader.
Mhm.
I wanted my team to perform like a team that's gone through one of your trainings, basically. But I hadn't gone through
Yeah.
one of your trainings and I didn't have those skills. So you're exactly right. It was like I wanted them to not be judgmental and bring things up
Mhm.
without conflict. But then when I brought things up, I brought them up with conflict.
Yeah.
And
Oh,
so it
100%.
was exactly the opposite of what should be
Mhm.
done, which is like leading
Mhm.
by example.
Yeah.
And I like when you first explained this to me many years ago, how you come to this team and say, like, listen, we all want to be in a workplace that is XYZ. We want to
Mhm.
be happy. We want to do
Mhm.
good work. We want to show up on time. We want to make good money. We want to do
Yeah.
whatever, right? And it's so nice when you frame it like that because you can go around to each person and say, that what you want? Yes. That's what you want? Yes. Yes, yes, yes,
Yeah.
yes, yes. Listen, guys, we all want the same thing.
Yeah. Yeah.
Great. Here's how we can do it.
Exactly. And it goes along with my team framework, but in reverse, which stands for thoughts lead to emotions that drive actions that manifest results. So if you're going to run it in reverse, which is the proactive, i.e., I jokingly say meat, what do we want to manifest right now? What's the end game goal? And so if we're all aligned with the end game goal, then therefore, what's the action that's going to drive that manifestation? What's the emotion that's going to be behind that? And what's the thought to give the emotion hope? And when you look at it in those terms, it's easier. I didn't say easy, I said easier to all get on the same page and start rowing in the same direction. And something else we talked about last night, and I love it when doctors have radical candor with me and they're like, well, you make it sound so easy. I said, well, technically, it's really simple, but it's not easy.
Yeah.
And the difference is consistency.
Yeah.
Showing up on a regular basis with these, within reason, of course, because we're all human and we have bad days, but showing up consistently along the lines that supports your culture constitution, whatever it says within it is the
Hmm.
important thing.
So with this topic of is it the conflict or is it the culture, it sounds like the answer is it's the culture.
Yeah, I would say yes. And I would also take a step back and ask myself, okay, what is this conflict teaching me? Or what is this conflict telling me? Um, is it just the people involved? Is it the systems involved? Is it lack of clarity? Is it lack of standard operating procedures? Is it lack of understanding of consequences? Like, what's the etiology, to use a more medical dental term? What's the etiology behind the problem that we're facing? And so,
I remembered what I was going to say,
oh,
and
cool.
which is when you're talking about meat, so
Hmm.
manifesting the results, the actions, the emotions, the thoughts,
Hmm.
it's kind of like treatment planning. It's
Yeah.
exactly like treatment planning when we talk
Yeah.
about facially driven treatment planning, or even if
Hmm.
you think of simple implant treatment planning.
Hmm.
The patient got, a central incisor knocked out by their dog, jumped up and hit him in the head. We want the tooth to be here.
Yeah,
If we want
exactly.
the tooth to be here, that means the implant has to be 4 millimeters apical to that. That means it has to be at this specific angle so that
Yep.
maybe we can do it screw retained. So we have good papilla and tissue thickness and bone thickness. That means if the implant needs to be there, the bone needs to be there.
Hmm.
If the bone is not there, we grow the bone.
Yeah,
And
totally.
it's thinking in reverse. I mean, when we talk about facially driven treatment planning, it's like, okay, the central incisors need to be here. It
Hmm.
needs to match the lower lip. We need these
Yeah.
proportions. Okay, that needs to be there. Now, how much do we need to prep to get there?
Yeah.
And don't over prep, right? Just do the minimum.
Right.
And it's the same way with our mental health. It's like we don't have to overdo it. We can do just what we need to do that'll fix that specific thing. It's when you think about it like that, dentists are very good at this.
Yeah. And you know what else I'm starting to think here, in a different way before, you talked so eloquently about communication, expectations, and boundaries. And
Yeah.
going through dental school is difficult, getting our degree is difficult, starting a practice is difficult, being an associate is difficult. It's just
Yeah.
different, difficult, right?
Yeah.
And so when these conflicts arise, it feels easier at the moment to let it go because we got enough difficult things that we have to deal with. But then the challenge becomes we then end up paying the price with interest because we've
Because it's
allowed it
festering.
to get going or to let
Because
go.
it's festering.
Yeah,
That's what you mean? Yeah.
yeah, yeah.
Right.
So it feels easier today to take a nap and not go to the gym.
Yeah.
But in the end, we're going to pay the price for not going to the gym.
Right.
It's the same idea.
Hmm. I know this is a big problem in marriages as
Yeah,
well. I
yeah.
think even for me, a person who trains on this stuff all the time, teaches people about it,
Mhm.
has learned from you over many years. I think even in my marriage, this is still one of the hardest things is to bring up things. It's like,
Oh, yeah,
do I want to die on this hill?
exactly.
Is the
Yeah.
question, like, or do I just let it go? But then uh, it festers in me, right?
Mhm. Yeah, totally.
Yeah, I think this is it's a big thing, and it totally goes back to communication, understanding
Mhm.
communication, importance of it, the expectations, the boundaries, like you said.
Yes, 100%.
So wow, culture is a big thing,
100%.
and I don't think very many dentists are thinking about culture.
No, I think what they're trying to do, and respectfully so, because dental practice is so challenging, they're just trying to get through the day.
Yeah,
So it feels like, or my observation is that we're trying to get through the specific incident versus looking at the etiology. So it's like when you have a headache, you're just taking a Tylenol versus looking at the reason for the headache. Is it muscular? Is it something really scary like a tumor or something? Like what's the reason? Is it sinusitis? What is it? So it feels easier at the time to just sweep it under the rug.
like
And
winning the battle and losing the war.
yeah, there you go. There you go.
Hmm. Yeah, I mean, there's a lot of, you're exactly right when you give that example. There's so much medicine that is just like that,
Hmm.
right? Oh, the
Yeah.
patient comes in. I mean, if we talk about it in dental terms, the patient comes in and keeps having cavities. So
Hmm.
we fix the cavities.
Yep.
Well, why don't we figure out why they're having cavities,
Bingo.
and then be preventative about it? Yeah. I mean, if we can be so preventative, try to be more preventative in dentistry. I think it's going to make us better. And if we can be even more preventative in our culture, in our mental health, in our communication,
Hmm.
that's the way to do it. In my complication compliance method, I have a 70-minute kind of a little mini course. And that's one of the big topics is like, let's talk about all the hard stuff up front. I mean, if I
You know,
summed it up in one sentence, that's kind of what it's about. It's
yeah.
like set all the bad stuff up front so that if it happens, you've already had the conversation about it and
You
everyone
know,
knows what we're going to do.
you know what's really interesting too? Like at both presentations at ADOM and the Seattle Study Club last night, I wasn't set to talk about delegation, but it ended up coming up anyway
Mm,
about, how to actually set this up from a communication perspective And for those of you who listen to our podcast, you know that I set this up a bit differently, and it's a whole script in the beginning until you get comfortable relative to, hey, listen, Kyle, I'm gonna hand you this task, and by default, you think that they're capable because why would you be asking them if
Right.
you didn't? So therefore, it's easy to actually pump them up a little bit. You say, Kyle, I'm really excited to turn this over to you. And so we're going to talk about the ins and outs, the who, what, when, where, why. And I want you to understand something. I very much believe this is as much about my ability to communicate as it is your ability to complete the task. So when I ask you to play things back for me today, tomorrow, next week, next year, it's as much about my making sure I'm communicating properly as it is your ability to complete the task. How do you feel about that? You have a conversation about it. And then the beauty of this is that if and when somebody doesn't follow through, you have something to go back to.
Yeah.
And so we had a whole discussion in all three episodes of this keynote. And it just kind of came up serendipitously and spontaneously in each of the three, which is interesting.
Hmm.
So,
Why do you think delegation came up when you're talking about culture?
because it had to do with communication, it had to do with people getting upset at time in certain examples, getting upset when people didn't follow up or follow through with certain tasks, those kind of things.
Ah, so they were delegated.
Correct.
Got it.
Yeah.
Okay.
Yeah.
Okay, so final thoughts on this. This has been super, super cool. Super.
Yeah, no, it's been fun. And it was kind of eye-opening to me too, because when I said it last night about is it culture or is it the situation, it even made me stop and think. But I
Yeah.
think the final thought is when things are happening in your practice, we've got to stop and ask ourselves, what's the etiology? Is it really the fact that the X team member doesn't want to do Y thing or they don't want to change because they're just jerks? Or is it something deeper relative to the
Mm.
practice itself? So really looking kind of behind the curtain, not just accepting things seem to be on a surface level.
Yeah. And speaking of etiology, if you think that your patients can see the etiology of things in their mouth by looking at a radiograph,
Mhm.
you are kidding yourself.
Yeah,
Which is why I started a company called Pearl, and we are an AI company that analyzes your radiographs as you take them. So within 8 to 30 seconds, everything will be colorized, color coded, circled, have percentages, measurements, so that your patient can basically put goggles on and now basically see what you see.
that's
It's been a
amazing.
huge game changer for all the dentists. We've had thousands of dentists that have been onboarded. And in our show notes, you'll find the link to get my founder's discount, which you can only get through me. So click the
Nice.
link, make a um, make a call, and talk to one of the associates and see if it's something that'll help in your practice.
I wish I
Martin,
had that when I was in practice. I
I
gotta.
know, right? I know. It's it's funny, once you have radiographs, I've been looking at radiographs that have been colorized since we started Pearl back in 2019. And now it's funny, you get to a point where you're like, black and white? What is this crap? It definitely changes the game.
That's funny.
Well, Martin, today was really cool. I learned a
Yeah,
lot.
yeah.
And I think it's a really big topic that is going to get even bigger because just now we're hitting the tipping point, I think, where people are realizing that it's not just all about clinical skills.
No.
The people that are succeeding, and I'm not just talking financially, but sometimes financially, that are succeeding in life are people that have soft skills. And that
Mhm.
is outside of dentistry too, but
Yeah,
definitely inside of dentistry.
yeah,
So really big stuff. And for those of you that haven't invited Martin to come speak and talk about this, come on, what are you waiting for? Talk to your local dental associations, talk to your study clubs, and bring Martin or me and Martin out. And we'd love to meet you guys. And
yeah.
thanks for all the support, and we'll see you on the next episode of Wellness and Dentistry.
Bye bye.